friends. Welcome back. We are so excited today doing another little chat with midwives around the globe about the state of events and state of situation in their community. Today, we're going to talk to a midwife from Peru to hear about what is happening because of the global pandemic there. So, big hello, big welcome. So happy to connect with everyone. It's always great to feel like we're a part of something bigger than ourselves, feel like we're a part of community. And today, like I said, we're going to get to hear it from a midwife in Peru. So stay tuned for that. As always, I do these chats almost every day, and then they end up over on my YouTube channel. So if you haven't already, definitely think about subscribing to my YouTube channel. That's over there. You can search for my name on YouTube. And always, we do those here. So I'm so excited to connect with everyone. And let's bring in our midwife. So let's see if technology will work for us today. Hi, how are you? So glad to have you. Can you hear me okay?
Yes, I can. Can you?
Okay, awesome. Welcome. Well, so will you do a little intro and tell
Mhm.
us who you are and where you are and how you are?
Okay, absolutely. So, hello everyone. My name is Susana Ku. I am originally from Peru, so I was trained as a midwife in South America, and then I came to Canada, and then a registered midwife here in Canada. I've been practicing here as a registered midwife for the last 5 years or so. Yeah, and how I am
Beautiful.
doing? I'm doing okay. I
Yeah.
have to apologize with Augustine because we were back and forth. I guess
Oh,
like
it's fine. It's fine.
the time
It
was
just
so confusing for us.
it's got to work out when it works, and that's why we do these just how we do. Like they just end up being organic and live, just like this. So thank you for being willing to talk to us
Yeah.
and making time in your day. So tell me a little bit. I know that you're connected with friends and colleagues still in
Yeah.
Peru. Yeah. What's the state of affairs there? What's happening with midwives on the ground?
So it's very complicated right now. Peru has a mandatory stay-at-home rule.
Yep.
So from Monday to Saturday, everyone is expected to be at home unless they're frontline workers
Okay.
from, as far as I know, 6 a.m. in the morning to 6 p.m. That varies whatever you're in a different city. Some cities, they
Okay.
start their mandatory stay at home at 4 p.m.
Okay.
Um, which means that everything is very limited, even prenatal appointments, lab work, ultrasounds,
Okay.
and standards are everything is locked down. Nobody can leave their houses, again, as long as they are healthcare providers or first line uh,
Oh, okay.
sellers or so. So I was talking to my friends over there, and it is very difficult now because they're only accepting people through emergency. So that means that there's no prenatal care, there's no follow up. The
Oh,
government has just opened this new guideline last week on mandating healthcare providers, especially midwives, to reach out to the community and then look in their list of due dates and then follow up with pregnant women. But as you can understand, that's very difficult because some people have changed their phone numbers. Virtually appointments are not actually part of their normal routine. Some people they can't afford having cell phones, especially if we're talking about very rural areas.
right.
So midwives are just working as emergency front lines. So they're people just come in labor. Some of them are just pushing the baby out. Every pregnant person comes into the ER goes to the fast swab for COVID-19. So they get tested, and it usually should take, because it's a fast and the quick test, it should take 45 minutes. But with the amount of people that are coming into the ER, it can take up to 2 or 3 hours. So
Wow.
imagine that in the second stage of labor. So by the time you actually have the test, the baby's born. And
Yeah.
then, yeah, so it is very difficult. In addition to that, midwives in Peru, we it's in our under our scope to provide family planning care. So people come to midwife for contraception services. So that is also canceled right now. So uh, women that are using, for example, the intramuscular injections, some of them are overdue for that, considering that they're at home and they're potentially at risk of being pregnant again.
Yeah.
And there is another policy that came in addition to that because of sexual violence and violence against women or gender-based violence. So it's a very difficult situation right now, as I imagine it's in other world and another part of
Yeah,
the world.
I think we're going to have
Mhm.
a real baby boom as a result of this
Yeah.
for many reasons. But one
Mhm.
that you brought up that I've heard other midwives talk about is those that are dependent upon the pill or Depo-Provera shots
Mhm. Yeah.
are not going to maybe have access with all these
Mhm.
stay-at-home orders, and we're suddenly going to have a rise in fertility. Yeah.
Yes, which in
Yeah.
countries like Peru, for example, is very complicated to manage and how it's going to move forward because abortion is not a service that people can access later on if they decide that's the option they want to take. Um, and if you're thinking about a person who is already using contraception because they can't afford having more kids at their house and they're already struggling to buy food or to have access to
Yeah.
water, clean water, or so you are increasing the cycle of poverty in some of the in some of the families.
Yeah, yeah, it's going to be very devastating, and certainly,
Mm,
I think in many areas of the world, that's maybe one of the most unique things about this pandemic is that
yeah,
if this were happening to any one area, it would be, everyone would be talking about how crazy it was, but because
yeah,
it's happening everywhere, the level of trauma can't even be discussed because it's universal.
yeah,
It's like this
yeah.
strange feeling. Like, I'm sure
Mm-hmm.
any one of us would be like, oh my God, you guys, look what's happening to me. But we can't
Yeah,
even, there's nothing to say because everybody
yeah,
is having this crazy universal experience. And now, on this major global perspective,
yeah,
all so many countries are going to be having the same like fallout from this
yes,
in
agree.
it, which will, again, just like we saw with the PPE, will dilute access to resources, will dilute response, and
Mm-hmm.
like is always the case, inequity will be greater.
Yeah,
Like
yeah.
like see
Some
and
of my colleagues see
oh,
that already. They're wearing plastic bags because they can't access PPE.
mm,
Some of them are just trying to be very creative on the way that they are getting their
right.
PPE. Even in Canada, for example, like here we are so fortunate to have very kind clients. They're sewing us masks. They are one of my colleagues' moms is making us gowns.
Mhm.
So so there's some good things that come from all this crisis, but it's very sad, and I cannot imagine how other people are doing it because at least here in Canada we have some extra resources so we can have access to, I don't know, phones and we can follow up with our clients that way. But in some other areas, it's not even a possibility. I wonder if they're going to see more out of hospital births with unattended births. And that's actually very difficult in that situation because people are not generally healthy. They
Yeah,
are undernourished. They have
yeah,
a lot of kids, so they're more prone to have postpartum hemorrhage,
yeah,
or yeah, you
yeah.
name all the complications you can ever imagine. Yeah.
Yeah, I just heard a report from a midwife in Ecuador,
Hmm.
who they did have cell phone and internet access, and so she helped the family help the mom have a baby over Zoom,
Yeah.
um, and then
Yeah.
got in the car and went to go help her. It was a precipitous birth, but she reported that she was 4 military checkpoints, 6 temperature screenings, and 2 fumigation checkpoints between her and the mother. So
Oh,
even if we have midwives who are offering home birth for families that are staying home, now the flow of the movement of even essential workers is so limited.
yeah.
Um,
Yeah.
and and we're seeing this, even the movement of essential workers within hospital systems. Like
Yeah.
I read somewhere recently that now entering and exiting a labor room in the hospital with proper PPE adds 14 minutes between
Mhm.
clients.
Yeah. Yeah.
There's so many barriers now. It's
There is, and there is this emotional barrier as well, because
mm,
as you imagine, people are going to be hesitating, or they're going to be thinking twice if they actually want to contact a healthcare provider, because as what you were saying, like there's some more things to add into the picture. Even just the thinking about like they're not going to be allowed to bring their support person into the
yeah,
hospital,
yeah,
right? In Peru, though, that was kind of the norm in the public health system. So women or the pregnant person is not necessarily allowed to go in just because how the facility is arranged. So there's one big room, and we have 10 beds, and 10 women may be laboring at the same time. So there's no way that a hospital have the capacity to actually allow a support person there, because it will be an invasion to someone else's privacy. And of course, they can come into the what they call the second stage room, where
yeah,
people are transferred to deliver the baby. So to sorry to yes for the birth.
yeah.
So that is not even in the picture of the if people in Peru right now, like, okay, I can't have a support person anyways. It's been the norm for many years, unless you actually go to a private clinic that you can pay or so on, maybe
Private
$1,
hospital. Yeah.
right? But still, it's that extra thing, because everyone in the country, in the world, I guess, is a potential COVID-19 patient. So they don't want to go through all that, because they know that they are already going to maybe uh, experience some trauma or violence from it, like because people are not even allowed, the support person is not even allowed to pass the hospital door. So they have to carry all their bags to get on their own to get into where they need to go.
Wow.
Mm-hmm.
Yeah, it's really, it has the potential to really change healthcare. I mean, those, you and I, we know that
Mm-hmm.
hospitals are for sick people, and that
Yeah.
normal people actually do better not in a
Mm-hmm.
technological hospital environment. Um, but it feels like, at least in the US, and I've heard many reports in Canada and in other places, it feels like suddenly that has become mainstream knowledge in just a very short amount of time, which is kind of
Yeah.
amazing. The problem being is that
Yeah.
because of obstetrics rapid move and monopoly,
Mm-hmm.
we don't have the services.
Yep.
So suddenly the mainstream is it's clear now that hospitals
Mm-hmm.
are for sick people. You know, it's like everybody get hospitals are for sick people. If you're
Mm-hmm.
not sick, stay home. Like that is the clear message. And so when we apply that to maternity care now, there's there's not enough providers to actually support most communities in most of the world.
Mm-hmm.
Even like I was talking to a midwife in the Netherlands, and even though the Netherlands is one of our home birth meccas in the world,
Yeah. Mm-hmm.
the volume next to some midwives being out because they're sick,
Mm-hmm.
next to being able to take care of multiple people, made several of the communities, I don't know what they're called, but like the townships or like the communities in the Netherlands, take over some of the local hotels and turn them into community birthing centers, so that at least they were keeping normal people out of the hospital, but they still had to bring them into a facility to be able to care for the numbers based on the shortage of supply, a shortage of providers, right?
Oh,
So we're talking about that in the US too. There are a number of initiatives now to open temporary emergency birth centers around the US to try to, again, keep normal people out of the hospital. But
mm-hmm.
have enough providers to take care of them, but we certainly don't have enough providers to take care of people at home,
Yeah.
which is hard to it's hard to deal with for midwives. Like I've
Yeah.
heard a huge range of emotions. What have you heard where you are?
In terms of policies for out of hospital births.
Well, just like you can hear the moms want it, and even the
Mm.
midwives want to do it, but it doesn't make sense from a numbers perspective. Like you can't take care of that many people when you're running from house to house. Is that what you're hearing?
So yes, a struggle in the big cities. Yeah, for example, here in Canada, the big cities, Toronto, Vancouver. So they are apparently having more late into care calls because they want to come with midwife because they know that at least they have the option to offer a home birth. But the capacity we have in terms of staffing is just so limited. And then, of course, midwives, we have the mandate to provide the best care we can in a safe way. So it's very unsafe for us to just take everyone who wants to come into midwifery care because the one-on-one care is not going to be it's not going to be possible. So and having another person late into care comes with the addition of like, what if this person is actually not suitable for a home birth and she just wanted to call and then switch because, well, it was her decision at that moment, but then you're taking that risk and you're making that very unsafe for the person as well, right? So we wish the world would understand what we were trying to say over so many centuries, that midwives are keen on the healthcare system. Like there is no other way. Regardless the model of care, because the model of care might vary dependent on where we are geographically speaking. For example, Peru and Lima will be very difficult to kind of adapt a home birth I don't know, service just because of the traffic and then how the people leave. They are usually big families in just one house, so it's very different. But having birth centers could be an option. Having actually in Peru, in the highlands, they have started since 2005, if I'm not mistaken. They started a new initiative that is called Casa de Espera. Casa de Espera is like a waiting house, right? So people will move from the highlands that are very far from the hospital or health center, and they will move with the family. Sometimes they move with their animals and so on, and they stay there. At least they're close to the healthcare providers. So that was one of the, but you have to make a lot of training and sensibilization in terms of culture, language, right? Because in Peru, we have so many dialects depending on where you are, right? And then some people want to continue with their religious practices, right? So, yeah. So, yeah.
But it is, there's some part of me that feels heartened, like finally people are hearing us, you know. I wish
in the year of the midwife, right?
Year of the midwife. It's kind of it's like bizarrely beautiful in a way. But I agree with you. Like I wish everyone had heard this message. You know.
Yeah, and it's actually not a competition. Like I feel like when midwives say like, oh, we are important, it's not a competition. We don't want to say that we're more important than others. It means that we're trying to actually say that actually teamwork needs to happen in the health system. So everyone counts. We need obstetricians, we need nurses, we need a phlebotomist, we need anesthetists. It's not that we are against the health system. We need them, but we also need to protect what a natural processing life is, right? It's the same as a respiratory therapist. They're great, but we're not trying to mess up on how we breathe. We just need them when they're, I don't know, required for our bodies to keep on going. It's the same thing. Like we protect birth as natural it is, but sometimes, yes, we need an obstetrician. We need them. And I feel like that divorce between healthcare providers is just so dangerous than a pandemic. Same as a pandemic.
It is so dangerous, and the results are devastating. And if we see the results being so devastating, in Canada and the US, I
Mm.
just, I can't imagine how devastating the results are around the world in less resourced
Yeah.
areas. Yeah,
Yeah.
so intense.
Hmm.
Well, so in Peru specifically,
Yep.
do you think women are staying home by themselves to avoid the hospital and the risk in the hospital?
And that's Lima, the city. They're staying because they're forced to stay, but they go out like any little alarm sign, they go out, and then the police, they will stop them and will ask questions, and as soon as they see them pregnant, they just take them to the hospital. So I feel like people, at least in Lima, they feel like because they are afraid and they're close to a hospital, they will go out and then say it. In provinces or like small cities, I can see people staying at home and then maybe asking for their parteras or their grandmas or other people they know that might be, I don't know, more experienced
Knowledgeable.
with birth, and they will stay, right? Yeah. So, but I see from a lot of people in Peru, just because of how I'm following my colleagues through social media, that they're just in this panic right now. That they're joining every single prenatal online course that they can. They're searching through Google, and you know how Google can play, right? In these places. So they are just getting so frustrated, and I don't know how much that anxiety is actually going to play against them, because that can become more like they can become symptomatic also as being anxious, right?
Right.
So yeah, yeah.
Yeah.
So
Yeah, that's so intense. Well, are you are safe in Canada? Yeah, and working still on call regularly?
yes. So the model of care here in Canada is, at least in my practice, every practice differs a little bit. So I'm on calls 24/7. So I started on call this Monday until next Monday. In my practice, we work in a team of two or three, depending. So we are three teams in my clinic. So I work in partnership with another midwife, and so we share the caseload. So one of us can have a week off, but that week that we are off, we are doing clinic. So for example, I'm on call right now, but my partner is doing clinic work. But because of social distancing, she's doing virtual calls Monday and Tuesday, and then people that needs to be seen, we're seeing them one day a week. Each team of midwife chooses one day of the week. That is with the intention to avoid having people in the waiting room and to decrease the social interaction. People
Right.
that come into the clinic, they wait in the car, and then we call them and let them know when they can come in. Yeah, and then for home births, uh, we always have to midwife at each home birth,
Yeah.
and then we are also uh, screening some people over the phone before a home birth, just to make sure that there is nobody like with COVID-19 symptoms or so. But it's just, yeah,
It's a
that's
lot.
how
It's so much.
it is
So
a lot.
how is your heart with all of this? How are you taking care of yourself?
That's a good question. I'm very fortunate to have a very supportive family. I cannot imagine doing this without the support of my husband, because I have a toddler as well. Um, we're trying to take it one day at a time, and then and I am very fortunate to have very kind colleagues as well, and we are always checking on each other, making sure that we're okay. Of course, as any other family, right? We have our own ups and downs in terms of like if someone is sick, we have to just rush
Yeah.
into things that are just not working and so on. But generally speaking, we are very supportive practice, and that actually makes a huge difference because we all know each other without even talking. We can just see if someone needs some extra help, and then so we're trying to yeah to help each other that way. So my
Midwives are
heart actually yeah my heart actually just it cries from people out there that I feeling so isolated. That's I think that what I'm more painful about. Like I know some, especially we have some new immigrants, and they have no family. They were waiting for the husbands to come, and they can't come because the borders are closed.
Hmm.
So many people that have their own story. So that as a midwife, you just can do as much, right? But some things are just beyond our hands. So we're trying just to be mindful about what are our what is our power, or how much we can do and how much we have to let it go, right? And just take its course.
Yeah, yeah.
Mm-hmm.
That that is so much. Well, thank you so much for taking your
Oh, you're
time
welcome.
with us
Yeah,
and for just everything that you're doing in your
yeah.
community near and far. It's
Mm-hmm.
a pleasure to connect with you. Thank you
Oh,
again.
it's a pleasure. Can I say something in Spanish? I don't know if someone in Spanish is seeing this video. Is that okay?
Yes,
Yeah.
please.
A mis amigos en Perú y a mis colegas en Perú, les mando un abrazo muy fuerte y quiero decirles que todo el mundo estamos viviendo esta crisis de una manera muy distinta. Pero quería decirles de que mi corazón y mi mente siempre está en Perú y con mis colegas, y vamos a salir de esto demostrando que las midwives en todas partes del mundo, o las obstetras, parteras, matronas en el mundo, somos una parte importante en la cadena de salud. Okay, thank you. Thank
Mm,
you, Augustine.